afternoon, everybody. This is our fifth or sixth Lunch and Learn now, which is great. Thank you for coming out. So again, the premise, the reason behind this is to learn more about what other departments within Stoney Health Services is doing, what they're, who they are, and to learn about them. Also, we're trying to incorporate in informational sessions. Bed bugs have become an issue in the community, so we'll be doing presentation on bed bugs. A few other topics. Again, as I've asked before, if you have any ideas, please come to me and let me know. So we have community health today. Community health today, we have the three of the members of the team. We have Rochelle, who's been here for 8 years. We have Janice, who's been here for 4 years. And Casey, who's been here for 10 years. Great. Wow. So without further ado, there you go. Great, thank you.
All right, yeah, so we're the community health team. I'm Casey, community health nurse, and also a lactation consultant. This is Rochelle and Janice. They are both community health nurses as well. So what do we do? So first thing we do is visit new moms and babies after delivery. So we do home visits, we weigh babies, check on them, check on their jaundice, help with feeding, all that kind of good stuff. We also do the Canadian Prenatal Nutrition Program, in which we see moms while they're pregnant, and then after they've delivered, they're eligible for food vouchers through that, and we just check in with them, follow them through their pregnancy, and support them in accessing services as needed. And then what our main conversation today will be about, we also run the immunization program here. So vaccines and the immune system. That's what we'll cover today. So a few things we'll talk about: the immune system, a little bit about childhood immunizations, not a ton, but just a quick overview. Then some adult vaccines, not all of them, but a little bit more detail. Seasonal vaccines like the flu and COVID, and then other ways to protect yourself, particularly during this season. So we just have a little video here about the immune system and how vaccines work. It's about 5 minutes long, rather than listening to me talk.
Vaccines have an important role in protecting us from infectious disease. But how do they work? Well, put simply, vaccines train our immune system to detect and attack pathogens. And we're going to walk you through how they do it from start to finish. Our immune system is a marvelously complex network of molecules and cells, which has the power to destroy pathogens like viruses and bacteria. The part of the immune system that vaccines train is called the adaptive immune system. Its first job is to recognize an invader. In the case of this bacterium, it does this by detecting molecular markers called antigens that are part of all pathogens. After detecting an antigen, the adaptive part of the immune system starts mounting a bespoke response. B cells convert to plasma cells and start creating proteins called antibodies, which bind specifically to the antigen. Together with immune cells called phagocytes, antibodies can destroy the pathogen. The adaptive immune system also produces killer T cells, which have the ability to detect and destroy cells infected with the pathogen. But it doesn't end there. To prevent against future infections, the adaptive immune system also has a memory. It produces long-lived memory cells, which lie in wait ready to pump out the right antibodies and killer T cells if the same pathogen is ever seen again. This is called immunity. Vaccines work by activating the adaptive immune system and so creating immunity. They safely introduce antigens for the immune system to train on, preparing itself to fight real infections in the future. So what actually goes into a vaccine? Well, there are several different types. One of the most common are called live attenuated vaccines. These include things like MMR or BCG. Live attenuated vaccines work by introducing a weakened version of a living pathogen into the body. These attenuated pathogens are not strong enough to cause disease in people with healthy immune systems, but they can still trigger a strong immune response. Live attenuated vaccines trigger a similar immune response to a real infection. leaving behind the same memory cells. This means that some can provide a lifetime of protection after just 1 or 2 doses. Another key type of vaccine is called a subunit or recombinant vaccine. They work differently. Instead of a live sample, subunit vaccines contain only part of the pathogen. For instance, the vaccine for human papillomavirus, HPV, uses hollow virus-like particles made from a protein found in HPV. Alone, these subunits cannot get the immune system's attention, and so they need a bit of help from another ingredient: an adjuvant. Adjuvants wake up the immune system, triggering it to see the subunit antigens and start creating antibodies and memory cells. Subunit vaccines contain no live pathogens, and so lack the genetic information needed to replicate. That means they are not infectious and are safe even for people with weakened immune systems. Great! But generally, they don't trigger the production of as many memory cells compared to live attenuated vaccines, and so they don't provide such long-lasting protection. Training the immune system through vaccination helps to protect individuals from infection, but vaccines can also protect people who can't receive them. This is called herd protection, or herd immunity. Herd immunity is created when a large percentage of a population is immune to a disease. It works by disrupting chains of infection. Without new hosts to infect, pathogens can't survive. That means that if a pathogen tries to infect someone who is vaccinated and so immune, it dies, and the chain of infection is broken. If enough chains are broken in a population, it becomes very difficult for pathogens to reach those who would be vulnerable. Herd immunity protects millions of people around the world. But if vaccination rates drop, there is a risk that diseases can reappear. For example, measles was declared eradicated in the United States in 2000. But since then, falling vaccination rates have led to a resurgence of the disease, with outbreaks recorded in 31 states. If herd immunity is maintained for long enough, though, diseases can be eradicated completely. For example, smallpox, which is estimated to have killed 300 million people in the 20th century, is now considered extinct. All thanks to vaccination, its training regime, and the wonders of herd immunity.
Okay, so I just want to reiterate probably the most important part of that whole video is the herd immunity. This is so important, right? We see here a whole lot of people aren't immunized. Even with just a few cases of a contagious disease, it spreads throughout the population. Again, if only some people get immunized, then it still spreads like wildfire. Oh, did I press it? I might have pressed it. Whereas if a lot of people are vaccinated, then the disease can't spread and we protect those who can't get vaccinated. So a few common reactions to vaccines. Now, every vaccine is going to be a little bit different. Sometimes there are more specific reactions, but generally across the board, swelling, redness, and soreness at the site is your most common. It's not uncommon to feel a bit tired, have a bit of a fever for a day or two, but the reactions tend to be pretty mild. If, you come see us, you get any vaccines, we'll of course go through any more specific reactions, but these are going to be your most common. So really briefly, just going through the childhood vaccines. So we immunize at 2, 4, 6 months, at 1 year, 18 months, and then at 4 years. That's considered the primary series. And then in school, kids will be immunized in grade 6 and grade 9. And through those few visits, kids can be fully immunized against a total of 15 different diseases. So the other thing to keep in mind is that you'll see multiple doses of the same vaccine, particularly for young kids. Their immune system isn't as strong, so they need multiple doses of these vaccines to mount a full response. But that means they do get that protection earlier. So yeah, definitely important to get those done. And now I'll pass it off to Riche.
Were you going to say something for this slide? Or?
No, I think it was you.
Okay.
I don't think so.
Okay. So is it still important to get vaccinated as an adult? What do you guys think? Yes, it's super important, especially, well, all adults need their immunizations, but especially as healthcare workers here in Manithni, it's super important. So we just wanted to give you some information about the immunizations that you might be eligible for as an adult. But if you have further questions, of course, just come see us and we can talk more in depth about it. So yes, it's important to still get immunized as an adult. So protection from some of these vaccines does wane over time. So boosters are needed to stay protected. For example, tetanus or our seasonal influenza vaccines that we'll talk a little bit more about. By getting vaccinated, you protect those around you who can't get vaccines or whose response wouldn't be as strong. So for example, elders, some people that have immunocompromising conditions, babies, those with allergies. Vaccines not only protect us against the initial illness, but also protect against sometimes lifelong complications. For example, hepatitis B can lead to liver cancer, and COVID can cause long COVID. So we want to be protected against these. Also, vaccines can keep us out of hospital, hopefully. If we were to still get these viruses, the goal is to keep us from dying, keep us out of hospital. So just to go into a little bit more detail about the vaccines that are offered in adulthood. So we call it Tdap. That vaccine gives protection against tetanus, diphtheria, and acellular pertussis, also known as whooping cough. We offer this vaccine every 10 years as adults, or if you were to get a significant wound, like a dog bite or a slice by something, we would most likely offer you a tetanus vaccine as well. Hepatitis B vaccine, anybody born in 1981 or later or with some additional risk factors is eligible. Typically, it's a series of 3 vaccines and it's a very effective vaccine. So once you've gotten these 3, most people are good for life. HPV or human papillomavirus, anybody age 26 or younger is eligible for this under the provincially funded immunization program. But that vaccine is anybody under 45 can get that vaccine, men or women. It is covered under our Manulife benefits. So if it's something that you're interested in, you can get that vaccine. We couldn't administer it here at the health center, though. It would have to be administered at a pharmacy. Measles, mumps, rubella vaccine is anybody born in 1957 or later is eligible for at least 1 dose of this vaccine. Anybody born after 1970 is eligible for 2 doses of this vaccine. Anybody that's a healthcare worker, so all of us, eligible for 2 doses of this vaccine. So just to show you guys some images of what some of these viruses and bacteria look like. So tetanus is a virus that is spread through the body through a wound. And most commonly that tetanus spore is found in like feces of animals, cattle, sheep, dogs, cats. And this is the most severe. So all of our muscles and joints lock up. It starts with what's called lockjaw. So we're not able to open our jaws. And so it can cause most damage for elders or people that have diabetes. And with this vaccine, our protection does wane over time. So this is why we get it every 10 years. So of course, this is the most severe. Out of people that do develop tetanus worldwide, 11% will die. And then in Canada, in 2022, which is the most recent data, there were 5 cases. Diphtheria is another virus that we're protected against. And this is a picture of the worst case of what diphtheria can, well, maybe not the worst case, but one of the complications of what diphtheria can look like. It can cause a film to grow in the back of our throats, making it hard to breathe. And it can lead to death. So out of the people that develop diphtheria worldwide, 5 to 10% of those people will die. And in Alberta, there were cases in 2017, 2018, and 2019. So pertussis, also known as whooping cough, is pretty scary and sad for a lot of babies. Most importantly, there have been 2 cases of pertussis in Manithni in 2024 alone. And I think both of those babies were hospitalized and got quite sick. pertussis is highly contagious. It's spread through coughing, sneezing. It starts out as a bad cough, and babies also go through spells where they can't breathe. And then when they try to catch their breath and try to inhale, it often makes like a horrible whooping sound. So it's a really horrible virus. I think that was all I wanted to say. A lot of these viruses too can lead to further complications like meningitis, brain damage, death. So it's important to get these, and all of these vaccines you can be protected against with one vaccine. Hepatitis B is a virus that affects the liver. It's passed through contact with blood and other body fluids. It can be passed through sexual contact. It can be passed from mom to baby. It can be passed through sharing personal items like razors. It can be passed through needles. Hepatitis B can cause cancers of the liver and permanent liver damage. Once we've gotten 3 doses of this vaccine, as we said, you're usually protected for life. So that's really good. And HPV is a virus that affects our skin and our skin cells. We didn't want to even put a picture of it because it's really not nice. But a lot of adults, it's estimated that if we don't get vaccinated against HPV and we're sexually active, 75% of adults in Canada will have an HPV infection at some time. If we're healthy and young, oftentimes this infection can be cleared, but sometimes it can cause genital warts, and then genital cancers of the head and neck for both men and women. This vaccine is offered for girls and boys at school, men and women, and really cool new data from 2024. So women that were vaccinated with the HPV vaccine before the age of 14 in Scotland, 0 cases of cervical cancer in that group that was vaccinated. So it was 100% protective in that study against cancer. So it's really amazing. It's the only cancer preventing vaccine that we have. Yes. This is a picture of a sad child with measles. So measles is one of the most highly contagious viruses. 1 to 2 out of 1,000 cases of people that contract measles can die. So far in Canada this year, we've had 82 cases of measles, including, sadly, the death of an unvaccinated 4-year-old in Ontario. So the measles vaccine is actually really effective. Once we get our 2 doses, it's like 98% protective against measles, which is really nice. And measles is so contagious that 90% of the people that are exposed to measles will actually develop it if they're unvaccinated. So it's really important to get those vaccines. Mumps is, so measles, mumps, and rubella are all in one vaccine. So you would get protection from all 3 of these viruses with your vaccine. So mumps is spread through the saliva of somebody that has that virus. And you can see Sidney Crosby had mumps in 2014. And so you can see the side of his face kind of swollen there. That's kind of the most common sign of mumps. And it can cause like swelling of the testicles, swelling of the ovaries, and brain swelling as well. In Canada in 2022, there were 27 cases of mumps. And this is a picture of a baby that probably contracted rubella when mom was pregnant. So it can cause the most damage for pregnant women in the first trimester. Babies are often, if mom gets, rubella in the first trimester of pregnancy, babies can develop different congenital abnormalities. If mom gets rubella in the second trimester of pregnancy, babies are often born deaf. And later on in pregnancy, babies are often okay, which is good. What else do I want to say about that? Rubella cases have declined from 2000 to 2022, 97% worldwide, thanks to immunization. And there was 1 case in Canada so far in 2024. There we go. How do I know if I'm vaccinated as an adult? So this is a common question that we get because it's hard to keep track of our immunizations. We often get a lot of them in childhood. So if you're not sure if you're vaccinated, the province of Alberta has a provincial database where we have access to your records if you were immunized in this province. A lot of our nations have really good record keeping. So if you're from another nation, we can often call there or fax there and get the records sent from there. Now, other provinces, it's tough sometimes to find records. A lot of provinces don't keep records for adults, so they might keep them up until you're 18 and then they no longer have them. So that can become pretty tricky if we're not from Alberta. So if you have that issue and you're not sure where your records are or where you're at, let us know. You can either call your public health unit where you grew up or where you were living, or your doctor's office, or we can help you in that process if you need any help.
Why it keeps going. I don't know why it keeps doing that.
Oh, there we go.
All right. Hi, I'm Janice, another community health nurse. So I'm going to talk about our non-routine immunization. So Riche and Casey kind of went over schedule for kids and what adults can get. I'm just going to cover kind of our seasonal immunization and those that we don't routinely get all the time. So your flu shot, your influenza vaccine, the COVID-19 vaccine, and a pneumococcal vaccine. So influenza, I just want to talk a little bit about those illnesses. Influenza, flu, and COVID-19 are both contagious respiratory illnesses. They're caused by different viruses, but they do share some similarities in their symptoms and transmission. So I just pulled a chart there. This is from Alberta Health Services .ca/immunize. It just kind of goes over the symptoms between COVID, flu, also the cold, and then GI illness. Now, this is not called a stomach flu, okay? When somebody has like diarrhea, vomiting, it's a GI illness, okay? Flu is really a respiratory illness. And we often hear people say, oh, I have the stomach flu. Well, it's not. Flu is a respiratory illness. So you can see they share a lot of symptoms in common. For example, like sneezing is common in COVID and also in a cold, but sometimes with the flu. One of those things that you won't see with having a cold and the flu is losing your sense of smell and taste. That will be COVID-19. Now, you can get not all of them when you're sick with the flu or COVID-19. You can get some. So how do you know if you have COVID or the flu? Oh, well, you don't. You can test, but I don't even know if we don't test here anymore. I'm not sure if all pharmacies carry COVID-19 tests, but really, they're both respiratory illness. What you're going to do for them are going to be the same in, protecting yourself and preventing the spread. So, but I just wanted to show you that chart so you could see some of the symptoms that you can have with both of those illnesses. So yes?
Is the influenza panel, does it include COVID in the influenza panel, or do you have to actually run two tests for COVID and for influenza?
It will be different tests. It's a respiratory panel that they would run. And typically they would test if you're hospitalized. If you're really sick and you get hospitalized and you have some kind of respiratory illness, that's when they probably would be testing. But if you're sick at home, like there's no way to know, do I have COVID, do I have flu? Unless you're losing your sense of smell.
I don't think we're testing at all.
We're not testing here, no, yeah. So how to prevent, so just the tidbits about how infectious they are. So people with COVID-19 can be infectious 1 to 2 days before symptoms appear. So you could have it and you don't know yet because you don't have the symptoms, and up to 8 to 10 days after your symptoms begin, and it can last up to 14 days. People with the flu can be infectious 1 day before symptoms appear and lasts 5 to 7 days after and up to 5 to 7 days after symptoms begin. So individuals who are asymptomatic can also transmit the virus. So you can have it and not be very sick, not feel like you're sick, and still transmit it to other people. It's transmitted through droplets. So those are small liquid particles. When you're sneezing, talking, or coughing, and also by contact with contaminated surfaces, because they can live on hard surfaces and in your hands. Also, COVID can aerosolize. So the aerosol is just like smaller particles of liquid that can come from your coughing and sneezing. So how do you prevent it? Well, your flu shot and your COVID vaccine. Covering your nose and mouth when you're sneezing, preferably with your arm, the crook of your elbow, rather than your hands. because you're going to be touching surfaces after. You want to avoid close contact with people that are sick. Avoid crowded, poorly ventilated spaces, wearing a mask in high-risk areas, and physical distancing. And frequent hand washing. That's a big one, so I wanted to talk a little bit about that. So your 5 moments of hand hygiene in a healthcare center. When do you wash your hands? Well, before any patient contact. So all those lovely hand sanitizer dispenser, just before the room. You wash your hands before you go into the room with your client. Before you do any type of procedure, like whether it's changing a dressing or helping with a cast. You're going to wash your hands after dealing with a dressing change or any type of bodily fluids. And you're going to wash your hands after you've dealt with a client, any patient contact. And then you're going to wash your hands after, sanitizing your room or after removing your gloves. So those are your 5 times you want to wash your hands. So pretty much all the time. And then at home, because you're not dealing with client, but you're going to be dealing with food prep. So before and after you handle food or prepare food, after using the bathroom, obviously, after blowing your nose, coughing or sneezing, and your pets, once after you touch your pets, cats, dogs, whatever pets you have, and after touching garbage. That's kind of a given, right? We all wash our hands, right? So a few key differences between flu and COVID. So obviously the virus type, they're 2 different viruses. The severity, COVID-19 tends to have a higher rate of severe illness and death compared to the flu. Also, it does spread more easily and can cause outbreak more quickly because of its ability to transmit through aerosols. Both illness have vaccines, but the vaccines are specific to the virus type. So your flu vaccine for influenza and then your COVID-19 vaccine for SARS-CoV-2. So it's not one vaccine to get both, right? Protection for both. You get a vaccine for each. Next slide. So now to our vaccines. We got our flu shots. So our flu vaccine covers 4 different types of flu. I'm not going to go into very much details about what they are, but you do get 2 types of A strains and 2 type B strains protection with the flu virus this year. And with the COVID vaccines, 2 mRNA vaccines, so the Moderna and Pfizer, so Spikevax and Comirnaty. And anyone who is 6 months of age and older can get the vaccine. And then with influenza, those that are 65 years of age and older are eligible for the high-dose flu vaccine. So it contains 4 times the amount of antigen. So just to mount a better immune response because their immune systems are not as strong. And then also with people with certain immunized conditions that are immunosuppressed. There's a list, but mostly like solid organ transplant recipient could get the high dose as well. With the COVID vaccine, so anyone 6 months of age and older for the Moderna, and then mostly will need only 1 dose this time around unless you're coming for a child who's under 4 and hasn't received any COVID vaccines in the past, may require 2 doses. And there are people with certain chronic medical condition that may require more than 1 dose. But of course, if you come and see us with to get your vaccine, we can go over that, check your health records and let you know what you're eligible for. So we do have the vaccine now. They just came in this Monday. We have the flu vaccine and we also have the Moderna. That's the only one we're going to be carrying here right now is the Moderna vaccine, the Spikevax, which protects you against the KP.2 variant that's circulating right now. And you can get both on the same day.
I was just wondering about the COVID vaccine. So is that going to be standard moving forward like that, just yearly? Like flu? Or?
So far, we haven't heard that it's going to be just a seasonal vaccine. That's why I kind of put it as an other vaccine. The flu continues to be seasonal, but as far as we know right now, you can kind of get it all year round, unless you've heard any otherwise. No.
Even if you've had like 3.
Yeah, so before you used to have a series like of 2 doses and then get the new vaccine that were coming out, because they're updating the vaccine based on the variants that are circulating, right? So to make sure that we're covering those variants. So this is the latest one, and the KP.2. So the vaccine's been made to protect us against that. We only need the 1 dose. Some people may require more doses based on certain like chronic medical condition. And so that's what we would go over with somebody that comes to see us for the vaccine, what you have for chronic medical condition, and if that qualifies you to get more than 1 dose.
Yeah, so flu follows it is seasonal, right? We see cases rise in the winter, they drop over the spring, not much in the summer, and then they start to come back up in the fall, right? COVID isn't yet following a seasonal pattern.
Yeah.
We see spikes all throughout the year. That being said, the vaccine uptake, I think everybody is pretty vaccinated out at this point. And so even, convincing the general public to get a single COVID vaccine in a year can be a lot to ask. So it's not so much that we're following what COVID is doing, but we're following more what the population is doing. And 1 vaccine seems to be as much.
Yeah. Yeah. And I mean, we don't know. It may change down the road, right? But for now, it's
entirely possible that in April some new strain will come around and they'll go, oh, we got to catch that one.
Yeah.
And they'll come out with a new vaccine for it.
Yep. And so I'm saying with the flu vaccine, they do kind of research and predict what subtypes, of the flu virus are going to be affecting our area based on all their research. So, right. So it's like their best educated guess, if you want, right? All right, next slide. So this is a little video. Yeah.
Someone that took the vaccine, like the Moderna and all that, the first and the second shot.
And the third and
Yeah. So you're saying that now we need to take another one?
He would like.
Yeah, so the recommendation is to get a new one. So this one will protect against the strain that's currently circulating. Those vaccines, we don't really know how much protection it will give down the line. We know that the strains have changed, so the protection isn't going to be perfect. There is a fair amount of immune escape happening with the different strains. So for best protection, yes, absolutely, it would be recommended that you get another dose. That being said, you will have some protection from the previous doses. How much? We can't really say.
yeah, kind of like the flu shot too. Every year the strains kind of change, right? So they mutate, so they come up with vaccine that they feel will provide protection for the flu virus. So the COVID-19 virus mutates too, so they're trying to cover those new mutations so you have better protection. And again, vaccines are a choice, right? We're not mandating the vaccine, but we highly recommend them because there's a lot of death from these diseases. Just with the flu itself in Canada, on average, each year, 12,000 people are hospitalized from the flu. And a lot in older adults and young children, but we do see healthy people too getting hospitalized. And on average, about 3,500 people die from the flu. So it is serious, and same with COVID. So this is a little video about the flu that I found.
The other thing to consider is that we do work in healthcare as well, right?
Yeah.
So it's not just for ourselves, it is for all of the clients that we see. And, if you aren't choosing to vaccinate, then maybe you choose to wear a mask throughout the winter so that you're protecting those around you, right? It's not just a decision for yourself, it is for everybody that you're in contact with.
Mm-hmm.
Each year, 1 in 5 Canadians gets the influenza virus, also known as the flu. The flu is much worse than a cold, with symptoms like fever, cough, fatigue, sore muscles, and more. The flu vaccine can prevent these problems, but some people still choose not to get it. Why? Let's look at 3 common myths. Myth number 1, I never get sick, so I don't need a flu shot. That's like saying since you didn't have a car accident last year, you don't need to wear a seatbelt. While it is unlikely that you'll get the flu every year, when it does occur, it can be very severe. The flu also spreads quickly, and you may catch it at school, at work, or out in public. You could catch the flu and not even know it and pass it on to your family. When more people are vaccinated, it's harder for the flu to spread. Myth number 2, the flu shot doesn't work. Each year, experts develop new vaccines to protect against what they predict will be the most common flu strain. Most years, the vaccine that they choose works very well. Although the flu vaccine is not always 100% effective, some protection is better than no protection. And if vaccinated people still get the flu, it's usually milder than in people who didn't get the shot. Myth number 3, the flu shot will make me sick. The flu shot can cause a mild fever and a sore arm, but it can't give you the flu. The particles in it are too weak. If you develop an infection soon after getting the vaccine, you are going to get sick even if you did not get the shot. Everyone over 6 months old should get the flu shot every year. Especially pregnant and breastfeeding women, parents, grandparents, and anyone who cares for children. The flu shot is your family's best defense against the flu. Talk to your doctor, nurse, pharmacist, or public health unit about the flu vaccine.
I like that little video because I like the myth about it. This is something that we get a lot with your flu vaccine. Oh, I never get sick. I don't need it. So I kind of like that video for that. All right. So I want to talk a little bit about bacterial pneumonia. So invasive pneumococcal disease. So pneumonia is a serious lung infection, most commonly caused by Streptococcus pneumoniae bacteria. It's the most common among the young and older adults, 65 years and older, and with those with chronic disease like asthma, COPD, heart disease, cancer, diabetes, etc. Pneumonia has to be treated with antibiotics and oftentimes can require hospitalization. Now, I just want to point out there are other bacteria that can cause pneumonia. The Streptococcus pneumoniae is the most common culprit for IPD. You may have received in childhood a vaccine that helped protect you against pneumonia. However, there's another vaccine for those at higher risk of IPD. So symptoms of pneumonia, you'll have a cough, oftentimes productive, fever, shortness of breath, chills, feeling very tired, very weak, and also chest pain often gets worse when you're coughing or breathing in. The vaccine that we have for pneumonia is called pneumococcal vaccine. It's Prevnar 20. It offers protection against 20 different serotypes of the Streptococcus pneumoniae bacteria. So you get that much protection. Who's eligible for this vaccine? So we have individuals 65 years and older. Population with sustained high rates of IPD, so residents of continuing care homes, nursing homes, First Nation, Métis, Inuit people, regardless of where they live, those with chronic medical condition and or immunosuppression, those with alcohol use disorder, those that use illicit drugs, smoke or vape, or are experiencing houselessness. And this is not an exhaustive list. There's other criteria that can make people eligible. And again, there's things that may change because we did have a vaccine before called pneumococcal pneumovax, so pneumococcal 23. So that may affect your eligibility, but we ask you to come and see us if you're wondering if you qualify for a certain vaccine, and then we can look into it and let you know if you're eligible for this vaccine. Most First Nation people here in the community are eligible for it if they haven't received a dose of this vaccine, and so we do offer it a lot here. And then that's it for that. Any questions for me, Riche or Casey?
Thank you. I just wanted to reinforce something that Casey said that I think is really, really important. That vaccinations, because we work in the health industry and we deal with sick people all the time, immunocompromised, vaccinations have to be looked at slightly different than the general public. we need to protect ourselves. We need to protect our clients, our patients that come into the building. So we used to have a list of required vaccinations and stuff that we needed to take. The new stuff that's coming up, COVID, we're not required to take it, to have the vaccination. And a few other ones we aren't required. It really is in our best interest and our clients' and patients' best interest. So we do really need to sit down and take a look at that and, make that decision. So thank you for mentioning that, Casey.
It's really a horrible feeling if you've been exposed to something and you haven't been vaccinated against it, but you could have been protected against it, right?
Yeah.
So.
And if I did bring some information about COVID-19 vaccine, about flu vaccine, and a pneumococcal vaccine, just the handouts that we typically give when you do get those vaccines. If you just want extra information, I have a few copies of these. I just have one copy of these, but I do have the biological page if you're ever interested in knowing what's in the vaccine and just more in-depth information. But if you want to know if you're eligible for any vaccines, or if you want to know if you're up to date with your vaccines, whether you need a new tetanus booster, just come and see us. We can access with your consent, your immunization records and kind of go over what you've had and what you can qualify for. But the flu shot and COVID vaccine are now here and we can start administering. We've given a few yesterday already. So if you want your flu shot, come and see us.
I was gonna ask about that. What's the best way? Like, just drop by? Do you want us to check?
Just drop by.
Just drop by.
Yep.
You know where our office is now? Yeah, pretty much. Yeah, your old office. Yeah.
Give one of us a call. Come
Yeah.
walk over.
Just talking about the
Yeah.
We're
phone kids room for it.
Yeah.
Stickers.
We have a comfy chair.
Yeah. And Darlene also can administer the vaccine if none of us are here or busy. I think Ben, clinic nurse, and Chantal will be able to do them as well. So most of our nursing staff should be able to give the flu shots. So.
Suzanne too.
And Suzanne too. Yeah. So.
I don't know if this came up when because I wasn't here for the run through lunch and learn. Did you guys talk about happy fitness at all, or supporting vaccination? I didn't do it.
No, we didn't.
Because I know sometimes that can be a thing for the younger kids if they're really anxious about getting vaccines, or if there's some neurodiversity there, they're autistic or there's something going on. If that's something that you want us to support with.
Oh, that's amazing. Yeah, I remember you.
Visits or things like that. We could do those things.
That's really cool.
Yeah.
For sure.
And
That would be awesome because I know that my daughter, who's autistic, will not even come near the building because she knows what it is.
Oh,
She had that first experience of getting her flu shots, and so we kind of have to
Gradually.
yeah, we're happy to see kids and just give them a sticker if that's the
Yeah.
first thing. Just
Yeah.
get them in the room and say hi and hand them a sticker and they go on their way.
Yeah.
We also immunize in the home, so if parents feel that the kids would be more comfortable that way, we're happy to do that too. And this year we can travel with. In previous years, we weren't able to travel with the COVID vaccine. This year we may be able to. So it might be an option that COVID is offered in the home as well.
Yeah.
And immunizations happen for the kiddos who are attending school as well, right? Does it happen for, say, Head Start?
Yep. So we connect with Head Start usually about twice a year. Now, whether or not we'll do flu and COVID vaccines, it's usually just the routine vaccines that we offer at school. That being said, if there's a specific request, then we can do that with parents' permission, of course. We also connect with the daycare too.
And then Jennifer is the school nurse, and she's over there every day offering immunizations and to the kids
At both schools.
At both schools.
Awesome. Any more questions? Well, thank you for listening.
Thank you.